It starts in the womb, of course. The field known as fetal origins, short for the developmental origins of health and disease, was featured in this October the 4th, 2010 issue of Time magazine. It asserts that the months of gestation constitute the most consequential period of our lives, permanently influencing the wiring of the brain and the functioning of our organs. This influence is more visceral than eye-tuning Mozart to the pregnant belly. It's the physical and chemical environment, such as results from maternal dietary patterns. This was first studied, namely the effect of maternal diet on early emotional and behavioral status of children, in the so-called Orange Journal of the American Academy of Child and Adolescent Psychiatry. This is a premier journal in the field, published in October of 2013. What was found was more useful than the magic flute. This was a study of over 10,000 pregnant women and subsequently their children up to 5 years after birth. They used a food frequency questionnaire that basically placed dietary patterns into two groups. A healthy pattern, characterized by high intake of vegetables, fruit, high fiber cereals, and vegetable oils, but some meat and dairy, sometimes referred to as a traditional diet, and an unhealthy pattern characterized by high intake of processed meat, products, refined cereals, sweet drinks, salty snacks, sometimes referred to as a Western diet. Child mental health, including both emotional and behavioral elements, was measured by a standardized instrument. Their conclusions were consuming a diet higher in unhealthy foods during pregnancy may increase the vulnerability for later mental health problems in children. Secondly, young children consuming a diet high in unhealthy foods and or a diet low in nutrient-dense foods such as vegetables display increased behavior significantly indicating mental health problems. A recommendation is that clinicians should discuss the possibility that good nutrition for mothers during pregnancy and for children in early life is important for children's mental health as well as for their physical health. These characteristics, once developed, may stick around during one's lifetime, suggested by research funded by the World Health Organization, who concluded that half of all lifetime cases of mental disorders start by age 14 and 3/4 by age of 24. Significant increases in the prevalence of adolescent emotional distress and behavioral problems have occurred over the past several generations. This clinical psychology review, published in 2010, reports that over the past 70 years, that something is changing in American culture that is related to increased psychopathology among youth. Paralleling this increasing mental health pathology among young people is a reduction in the quality of adolescents' diet over recent generations, with decreasing consumption of raw fruits, high nutrient vegetables, and associated increases in fast food, snacks, and sweetened beverages, with increasing obesity. Could teen consumption of junk foods and other unhealthy dietary choices be contributing significantly to the burgeoning mental health crisis in that age group? Does junk food lead to junk mood? The very limited studies of the apparent relationship of dietary patterns in adolescents and their mental health are most often at a single point in time, so-called cross-sectional study. For example, this study, published in 2009 on the effects of diet quality on adolescents, concludes, these findings implicate a Western dietary pattern in poor behavioral outcomes for adolescents. Better behavioral outcomes were associated with higher intake of fresh fruit and leafy green vegetables. Here's another cross-sectional study, this one published in 2010, based on over 3,000 adolescents by a group at the University of Melbourne, who concludes an association between diet quality and adolescent depression that exists over and above the influence of social, economic, family, and other potential confounding factors. This cross-sectional investigation was extended over a time interval of several years to become the first so-called prospective study shown here. In this study, diet quality was associated with adolescent mental health both cross-sectionally and prospectively. Moreover, improvements in diet quality were mirrored by improvements in mental health, while reductions in diet quality were associated with declining psychological functioning over the follow-up period. So my own conclusion is that we are at a very early stage in our understanding of dietary effects on child and adolescent emotional and behavioral health, but there does appear to be a significant effect. Please also check out my videos on dietary effects on cognitive, emotional, and behavioral disorders in adults and geriatric adult populations.